Selective estrogen receptor modulator, that is SERM. Selective estrogen receptor modulators. Tamoxifen, raloxifene, and ormeloxifene are selective estrogen receptor modulator. Tamoxifen, raloxifene, and ormeloxifene. So the mnemonic is TOR. Tamoxifen, ormeloxifene, and raloxifene. Tamoxifen, ormeloxifene, and raloxifene. Tamoxifen, ormeloxifene, and raloxifene. These are selective estrogen receptor modulators and have tissue selective actions. Estrogen like action in some and estrogen antagonistic action in other. Estrogen like action in some and estrogen antagonistic action in other tissues. Okay, what is the meaning of selective estrogen receptor modulator? That they will have estrogen like action in some tissues and estrogen antagonist effect in other tissues. First is tamoxifen. Tamoxifen is a non-steroidal compound with a selective ER modulating effect. Tamoxifen is a non-steroidal compound. Action. It has estrogenic action on endometrium, bone, and plasma lipid. Bone it causes anti-resorptive effect. Endometrium, it causes endometrial proliferation. And plasma lipid it reduces cholesterol and LDL level. Estrogenic action on bone means anti-resorptive effect. Estrogen has anti-resorptive effect on the bone. In plasma lipid, it decreases the cholesterol and LDL levels and it causes endometrial proliferation. Causes endometrial proliferation, anti-resorptive effect on bone and decreases LDL and cholesterol levels. Endometrium hyperplasia, anti-resorptive effect on the bones and it decreases cholesterol and LDL levels. It has anti-estrogenic action on breast cancer cells and peripheral sites. Anti-estrogenic action on breast cells will reduce the tumor size. On peripheral site, it causes hot flushes. So anti-estrogenic action on breast cancer cells, it will lead to reduction in the tumor size, and on peripheral sites, it will cause hot flushes. So the action of tamoxifen is it reduces tumor size, it causes hot flushes, it causes endometrial proliferation, it has anti-resorptive effect on bone, and it decreases cholesterol and LDL levels. So it causes endometrial proliferation, it decreases the rate of resorption of bone by inhibiting the activity of osteoclast. Osteoclast को inhibit कर देगा तो जो bone का resorption है वो inhibit हो जाएगा, वो decrease हो जाएगा. And it reduces blood cholesterol and LDL levels and decreases the risk of cardiovascular diseases. So this is the advantage कि tamoxifen के कारण जो सीवियस डिजीज़ेस हैं उनका रिस्क कम होता है. Pharmacokinetics. Tamoxifen is well absorbed on oral administration, metabolized in liver and excreted in the gut via bile and undergoes enterohepatic cycling. Oral administration, well absorbed, metabolized in liver, excreted in the gut via bile and undergoes enterohepatic cycling. Excreted via bile and undergoes enterohepatic cycling. Uses. Tamoxifen is used orally in the carcinoma of breast. Okay, it is used in the carcinoma of breast in both premenopausal and postmenopausal women. It is used orally in the carcinoma of breast in both premenopausal and postmenopausal women. Adverse effect: nausea, vomiting. The other side effects are hot flushes, increased risk of endometrial cancer and venous thrombosis. Okay, so tamoxifen, it is a non-steroidal compound. It reduces the tumor size. तो इसका यूज़ होता है कार्सिनोमा ऑफ ब्रेस्ट में इन बोथ मीनोपॉजल एंड पोस्ट मीनोपॉजल वुमेन. एडवर्स इफेक्ट क्या है कि ये हॉट फ्लशेस करवाता है, ठीक है, पेरीफेरी में. इसका एंटी ईस्ट्रोजेनिक एक्शन होगा, इट विल कॉज हॉट फ्लशेस. ये एंडोमेट्रियल प्रोलिफरेशन करवाता है जिसके कारण एंडोमेट्रियल कैंसर का रिस्क इंक्रीज होता है एंड इट ऑल्सो कॉजेज वीनस थ्रोम्बोसिस. ठीक है, hot flushes increased risk of endometrial cancer and venous thrombosis. And we have raloxifene. Raloxifene has affinity for both ER alpha and ER beta. Raloxifene has affinity for both ER alpha and ER beta. So raloxifene, the estrogenic action on bone, anti-resorptive effect and reduces the risk of vertebral fractures. Anti-resorptive effect and reduces the risk of vertebral fractures. It reduces the cholesterol and LDL levels. तो बोन पे एक्शन सेम है, प्लाज्मा लिपिड पे एक्शन सेम है. कि ब्लड में इट इंक्रीजेस द रिस्क ऑफ वीनस थ्रोम्बोसिस. ईस्ट्रोजन के कारण वीनस थ्रोम्बोसिस का जो रिस्क है वो इंक्रीज होता है. सो दिस इज़ अ एडवर्स इफेक्ट. एंटी ईस्ट्रोजेनिक एक्शन ऑन एंडोमेट्रियल, नो एंडोमेट्रियल प्रोलिफरेशन. तो ये एक एडवांटेज है रिलॉक्सीफेन का कि इट हैज़ एंटी ईस्ट्रोजेनिक इफेक्ट ऑन द एंडोमेट्रियम जिसके कारण एंडोमेट्रियल प्रोलिफरेशन नहीं होगा. On breast, anti-proliferative effect on the ER positive breast tumors. ठीक है, ब्रेस्ट पे भी एंटी प्रोलिफरेटिव इफेक्ट है. एंडोमेट्रियम के पे कोई भी प्रोलिफरेशन नहीं होगा और ब्रेस्ट पे एंटी प्रोलिफरेटिव इफेक्ट होता है. Riloxifene is rapidly absorbed after oral administration but has poor bioavailability due to extensive first pass metabolism. Rapidly absorbed but has very high first pass metabolism जिसके कारण bioavailability बहुत poor होता है. It is used for prevention and treatment of osteoporosis in post-menopausal women. रिलॉक्सीफेन का यूज़ क्या है? टू प्रिवेंट एंड ट्रीट ऑस्टियोपोरोसिस इन पोस्ट मीनोपॉजल वुमेन. द एडवर्स इफेक्ट्स आर हॉट फ्लशेस, लेग क्रैम्प्स, increased incidence of deep vein thrombosis and pulmonary embolism. It does not increase the risk of endometrial cancer. ये एक एडवांटेज है कि इसके कारण एंडोमेट्रियल कैंसर का रिस्क इंक्रीज नहीं होगा, बट और भी साइड इफ़ेक्ट्स है, एडवर्स इफेक्ट है, जैसे कि हॉट फ्लशेस, लेग क्रैम्प्स, डीप वेन थ्रोम्बोसिस और पल्मोनरी एम्बोलिज्म. हॉट फ्लशेस, डीप वेन थ्रोम्बोसिस, पल्मोनरी एम्बोलिज्म और लेग क्रैम्प्स. यूज़ क्या है? इट इज़ यूज इन द prevention and treatment of osteoporosis in postmenopausal women. Last is ormeloxifene. Ormeloxifene, a selective estrogen receptor modulator, has antagonistic effect on breast and uterus. It is used for the treatment of dysfunctional uterine bleeding. Okay. Adverse effect: headache, weight gain and nausea. Ormeloxifene, it is a selective estrogen receptor modulator. It has antagonistic effect on breast and uterus. It is used for dysfunctional uterine bleeding. Ormeloxifene का use for dysfunctional uterine bleeding. Adverse effect: headache, weight gain and nausea. Adverse effect: headache, weight gain or nausea. Ormeloxifene, it has antagonistic effect on breast and cancer. Use: treatment of dysfunctional uterine bleeding. The example of selective estrogen receptor modulators: tamoxifen, raloxifene, ormeloxifene. Tamoxifen का यूज़ क्या था? ब्रेस्ट कैंसर. It is used orally in carcinoma of breast in both premenopausal and postmenopausal women. Riloxifene, it was used in the treatment of osteoporosis and prevention of osteoporosis in postmenopausal women. Ormeloxifene is used in the treatment of dysfunctional uterine bleeding.